Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and to delve into the challenges and impact each technology has in practice. This is the Medtronic MedEd learning experience. The BIS monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. Reliance on BIS system alone for intraoperative anesthetic management is not recommended. Medtronic's medical education programs are offered to provide attendees education on the FDA-cleared indications and use of our products when applicable. The contents and conclusions of the following program are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers received funding from Covidien LP, a Medtronic company, for the speaking engagement. For this segment of the series, a discussion on anesthesia and the brain, we will dive into enhanced recovery and discuss how BIS can be included in the protocol. To provide insight into this topic is Dr. T.J. Gann, Professor of Anesthesiology and Distinguished Endowed Chair at Stony Brook University.
We started an enhanced recovery protocol when I was at Duke in colorectal patients, and following the enhanced recovery elements that I showed you earlier with preoperative educations, carbohydrate drink. Intraoperatively, we have multimodal analgesic approach. We have a guided fluid management with a non-invasive cardiac output monitors. We have a neural monitors with bispectral index, reduce number of drains and avoid urinary catheters, and post-op increase early return of oral regimens and food, and early return of bowel function, as well as encouraging post-op mobility. And with that, we showed an average of 2 days reduction in hospital length of stay. Whether they are open colectomy or laparoscopic colectomy, we are still able to show 2 or just over 2 days reduction in length of stay. And obviously, the complication rate also came down. We have lower incidence of urinary tract infection, lower incidence of surgical infection, and lower incidence of readmission for following discharge. And more importantly, we also found that the cost of healthcare delivery in that patient, on average, we were able to reduce about $2,000 savings per patient. And in about 30% of patients, the saving went up to about $4,000 per patient. So you can see clearly that practicing enhanced recovery and targeting the right elements in these patients, not only the patient's outcome was better, the length of stay came down, lower complication rate, but also reducing the cost of that hospital admission. So in a sense, you increase the value of the healthcare money that we spend. As I said earlier on, based on the healthcare system today in the U.S., we don't get very good value from the healthcare dollars that we spend. And enhanced recovery enable you to increase that value of the money that we spend on our healthcare for our patient population.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.